Hi, I'm Dr. Birkenstock, owner of Skin Body Health, with offices in New Orleans and Mandeville, Louisiana. Whether you live here or whether you live out of state, we're happy to help you with any of your issues for anti-aging and any hormonal needs. Tonight we're going to talk about hormones. Well, happy life is happy hormones. When we get your hormones aligned, you not only anti-age, but everything looks and feels better. As we age, our hormone levels decline. It can be estrogen. There are three types of estrogen: estrone, estradiol, and estriol, testosterone, progesterone, sex hormone binding globulin, otherwise known as SHBG, pregnenolone, and the list goes on. Along with this, we often watch your thyroid hormones because thyroid hormones are very much integrated in the sex hormones, and when one is off, the other is off. So what we have gone to learn and research is that hormones are a cascade. They're a symphony, and when the orchestra is playing beautiful music, we feel good. When the orchestra is not playing beautiful music, we can feel fatigued, depressed, almost like a magnet's on our tush, holding us back into the couch, causing a lot of procrastination, depression, and moodiness. This can happen for men as well as women. In women, we're very familiar with the word, and it's called menopause. The menopause is that period of time when your menstrual cycle stops 1 year and then towards the end of your life. So sometimes people think they step out of menopause. That doesn't really happen. It's sort of like your pre-cycle when you're a child and preteen, and then you begin to have your cycle, so when you're a teen, until when you're somewhere between usually 48, 52. Of course, that's an average, and it can deviate either way. Or if you would need surgery, causing a surgical menopause, when they might have to take your uterus, ovaries, or whatever for some medical reason. Regardless, any of these issues will throw you into a state of menopause. Well, what happens exactly in menopause? Well, our testosterone, and yes, ladies has testosterone too, will decrease. Our good estrogens, estradiol and estriol, will decrease. Our bad estrone starts rising. That's the one that's responsible for most breast cancers, and that's estrone. And it just increases naturally after we hit menopause. In addition to that, we also can lose some pregnenolone, which is just another one of the hormone cascade. Very often, but not always, our thyroid will get sluggish. When the thyroid gets sluggish, the very best thing to do is to bring it back to a normal triad. You never want to overstimulate the thyroid. However, leaving it sluggish would cause untoward effects such as weight gain, moodiness, depression, fatigue, sleepiness, muscle aches and pain, and some other issues. So when our true sex hormones, as I was describing earlier, decrease, we can have low energy, weight gain, insomnia, loss of libido, not interested in our partners. Some women can have memory issues, like, where did I put my keys? Or what did I come in this room for? And you have to backtrack and think it out. When you replace those bioidentical hormones, meaning your sexual hormones, with or without thyroid, if the thyroid is sluggish, I certainly recommend replacing that. Life gets rebalanced, and it's almost like magic. Menopausal symptoms and andropause or male menopause is what we say for the men. And before, it's really kind of a shame. The men used to get ignored. We would just say, oh, they're just sweeter, or they're, more passive, or they've just gotten older, they're sweet like grandpa. However, that's really not healthy for a male. It can increase cardiovascular disease, cholesterol, and other things as well, and certainly cause them brittle bones. And yes, males, although very rare, get breast cancer too. And in a male, when testosterone goes down, bad estrogen, estrone, goes up in most cases. So we have to be cognizant of that as well. But tonight's purpose, and we'll do another separate webinar strictly related to men, but for tonight's purposes, when we have menopause or female symptoms, we will see hot flashes, night sweats, vaginal dryness, decreased interest in sex, sex can become very painful because the tissue changes. Instead of a nice thick, a bulbous layer of nice thick spongy tissue, it can become very cellophane-like. And then when tissue is rubbing on tissue, it can become very painful. And that is 6 weeks with bioidentical hormones, and that problem is gone. Of course, problem sleeping. So when we lose our progesterone, progesterone is our sleep hormone as well as melatonin. So when progesterone goes down, our sleep quality goes down, and then also up in the pineal gland, most times, not always, our melatonin decreases too. So when you support the melatonin and the progesterone, then most times, or the majority of times, you get a situation where sleep quality is restored. In addition to this, during menopause, we see a decrease in muscle mass, some weight gain, especially around the midriff, which is so unwanted and can sometimes result in that muffin top. We talked about muffin tops last week when we were talking about the ways to decrease cellulite and fat in unwanted places. So reflect back on last week's video on cellulite and lymphatic drainage if you have that particular issue. Don't forget to like and share this video to be entered into a drawing of a free bottle of FemHerb. That FemHerb is the product we'll be talking about later. And FemHerb is one of our Class A products that brings down that bad estrogen and increases the good hormones. We'll get back to more on that later. Oh, without further ado, let's talk about last week's winner. We had the lymphatic drainage cellulite video. And the winner of that particular video was Sandra Trussell. So Sandra Trussell has won herself a free session of lymphatic drainage here at either one of our clinics. And if you just call in, we'll be happy to set up an appointment for you. So click the link in the description below. Join us, subscribe to us, and be a part of our family. If you've missed any of our previous webinars, they can be found on our YouTube channel, Dr. Birkenstock Skin Body Health. So let's go on. So we talked about when we do replace the hormones with bioidentical hormone creams. I prefer the creams. There are many reasons why. We can get into that at a later date. I'm not a big proponent of the pellets, and certainly not shots or anything you would swallow, because it's very harsh on the kidney and liver, besides other things. I've undergone extensive training in not only internal medicine, but in anti-aging and skin and regenerative medicine. I have a fellowship from the anti-aging and regenerative medicine, A for M, that I've held now, since 2010. So we continue to study, we continue to learn, I continue to go abroad to bring you the latest and greatest on what is out there in terms of anti-aging, skin care, and hormones. Synthetic hormones, those are the ones that we can get at the pharmacy and simply swallow, or the injectables, which I don't believe in at all, because they give us a surge and then we pop down, and that is not good for a car, and it's certainly not good for a human. The synthetic hormones that we swallow or we inject have a lot of foreign substances. These foreign substances can produce toxic byproducts, like animal estrone and progestin, which we know to be of cancer-causing elements. And other diseases as well. So when we test for bioidentical hormones, before we give a patient bioidentical hormones, we're going to look at their 3 types of estrogen: estrone, estradiol, estriol, progesterone, testosterone, total and free, DHEA, melatonin levels, pregnenolone, sex hormone binding globulin, and a few others. So we're not going to guess at what's right for you, and that's done a lot, or a simple script is written without testing. And I particularly feel like, at least in the study regime that I follow and the degree that I learned with, is that you should know where a client is at baseline to then prescribe whatever hormones. I love the Bioidentical plant hormone creams. They're very simple. It's a tiny, tiny bit of cream that is applied and it's done for the day. And with that, you're then going to balance that symphony of hormones and feel great, look great, and just shut down a lot of those untoward effects. So hormone replacement therapy, is it right for you? Well, if you're beginning with perimenopause or menopause and are starting to have the hot flashes, the night sweats, or your waistline is imploding, mood swings, or if you're a man, you're starting to settle with, I just I can't find my mojo. I don't have the strength, the stamina. I'd rather just sit here on the sofa and watch football. Then you're finding your feminine side. And without being sarcastic at all, when men start holding on to that sofa and watching the football games or the action videos or movies, they're really sliding into that feminine side, which will further decrease their testosterone. This has been proven in scientific research studies, and it's really not good for the male. We didn't know this before, but we know it now. So if a female, we're going to put you back where you needed to be with your E2, E3, testosterone, DHEA, and what other hormones you're lacking. With the male, we're going to support you with a cream as well. It's not much, just a tad. With your testosterone, DHA, sometime progesterone, sometime an estrogen blocker, and get you back where you need to be. What we find with the females, we lose the hot flashes, night sweats. We decrease that weight. We improve that memory and cognition. When we look at the males, what we find is that it improves stamina, libido, and vitality. And in addition to that, they get their career mojo back on, and others, so they don't feel like sitting on the sofa. They're going to, like, if they used to take care of the landscape, they're going to get back out there and take care of the landscape. Or whatever it was that was taking up a lot of their hobby time, which is now the magnet on the sofa. And again, I don't mean to make that sound sarcastic, but we know this to be true in the scientific studies. In the women, we see a lot more weepy and teariness and missing of old habits. Maybe it's children, maybe it's visitation, or whatever it was in their past. And you begin to see a lot of sullenness. This does not have to happen. We simply replace your hormones and get your mojo back on. So we talked about things of the sexual nature. Also, hormones will strengthen your bones. So it's decreasing your risk of osteoporosis, and it's also improving your cardiovascular health. So while the benefits do outweigh the negatives, it's always important to educate yourself on the pros and cons of anything, whether it be reproductive hormones, hormone replacement, or any other medication. Of course, talk to your doctor before taking any hormones or supplements. So without further ado, let's talk tonight about our product, FemHerb. FemHerb HRT is a great product. This particular product has only supplements and herbs and nothing of a prescription type of a nature. What it has involved in it that makes it really claim its fame is it's got chaste tree extract and black cohosh. Both of these two herbs are widely known for their balancing effect on hormones. They're considered an adaptogenic herb. Adaptogenic means if your hormones are low, your good hormones are low, it'll kind of talk with or maybe communicate with the adrenal gland to normalize that hormone. If that particular hormone or another set of hormones is too low, it's going to bring it up to normal. So it's an adaptogenic herb. Big words meaning it adapts. So if something's too low, it tries to help it get normal. If something's too high, it tries to bring it down to get normal. And when everything is normal, we feel right. So for some very, very mild issues, mild perimenopause or mild hormone issues, you may want to consider something like FemHerb HRT, which has that chaste tea extract and black cohosh, which has got a tremendous long history of assisting and helping with vaginal dryness, night sweats, and other uncomfortable things, bloating in perimenopause and menopause. Calcium D-glucarate, that supports the liver and absolutely detoxifies and eliminates that bad excess E1 estrogen or estrogen that is known so much for causing cancer. This product, our product, FemHerb HRT, also includes DIM and Brassica oleracea. Those are vegetable extracts from the broccoli and cabbage family. We know broccoli and cabbage not only decreases your risk of cancers in general, colon cancer, all kinds of cancer, but also helps decrease bad estrogen levels. It blocks the conversion of good estrogens and testosterone to the bad estrogen, E1 estrogen. So it produces more favorable metabolites. It also helps the DIM with bloating, breast tenderness due to excess estrogen buildup. So FemHerb HRT is a wonderful product whether you're going through the beginning stages of perimenopause, meaning your periods are starting to change, you're starting to have a little bit of hot flash, a little bit of night sweats, or whether you're bragging right up in the mood of menopause. For the men, we have a different product, although this wouldn't be harmful. We have a different product more geared to strictly the male profile. In addition to this, it contains resveratrol. Resveratrol is from the red grape, not black, not green, but actually the red grape, and green tea extract. Resveratrol and green tea extract are antioxidants and anti-inflammatories, and they support the body's natural defenses that fight against oxidative damage, which is just a big word for damage that occurs to the human body every day that ages us. So if we get something that blocks some of that damage, not only do we live longer and look better, but it reduces cramping, PMS, and all the things that go with it. FemHerb HRT also contains calcium and magnesium. These are great for helping to keep our blood pressure under control, bone health, slowing down muscle contraction, improving proper muscle contraction, and which decreases cramping, tension, and other physical pain, sometimes associated with your monthly cycles. Vitamin B6, B12, and folate, otherwise known as B9. Those are essential for happiness, mood, balance, and healthy cell signaling and function. Those three vitamins in the B family contain homocysteine. They are required to help us maintain a proper level of homocysteine, which is related to great cardiovascular health. So this product is a win-win for anybody who has those changing hormonal imbalances and needs a little bit of support. Well, what can you do to support yourself naturally? Well, you can eat foods that are good in calcium, such as eggs, kefir, some of your non-dairy milks like almond or cashew or even coconut, Greek yogurts, and things of this nature. Vitamins B6, B12, and folate, that would be in lean cuts of red meat once in a while, and your green super leafy vegetables. So, if you've missed any of our webinars, please go to our YouTube channel, Dr. Birkenstock Skin Body Health. We'll take some questions now, but FemHerb HRT will be 20% off for this entire week for anyone that might be interested in trying the product.
If I'm a male, can I take FemHerb HRT?
You can take FemHerb HRT. We also have some other products that are more dedicated. If I saw the blood work, I could answer that better. If your estrogens were very, very high, certainly yes. If your estrogens were moderate, then I might suggest another product. Okay, so in conjunction, if you're getting the pellets or something else, can you take this to give you an additional support due to the vitamins and minerals inside it? You absolutely can mix it with whether it's hormone pellets or hormone injections. Again, those aren't two of my favorites, but if you're on either one of those, you can certainly blend that with FemHerb HRT, and it'll only be synergistic and nothing that will be deleterious or damaging. Well, thank you everybody for joining us. It's been an absolute pleasure to serve you tonight. Our YouTube channel, Dr. Birkenstock Skin Body Health, will be here every week for a webinar, unless it's Christmas week. And it's always a pleasure to speak with you.